Stress and coping mechanisms are a common area of concern for mental health professionals. However, when working with clients from different cultural backgrounds, mental health professionals must also be aware of the ethical dilemmas related to cultural sensitivity. In this video, we will explore the ethical dilemma of balancing cultural sensitivity with evidence-based interventions when dealing with stress and coping. The ethical dilemma of cultural sensitivity arises when mental health professionals are faced with the challenge of providing the best possible care to their clients, while also being mindful of their cultural background. Mental health professionals must balance the use of evidence-based interventions with cultural sensitivity to ensure that they are providing the most effective and culturally appropriate care. One of the main challenges of cultural sensitivity is that different cultures have varying views and attitudes towards stress and coping. For example, in some cultures, mental health issues may be stigmatized, and clients may be reluctant to seek help. In other cultures, there may be different expectations of the role of mental health professionals or beliefs about the nature of mental health problems. This creates a dilemma for mental health professionals, who must be aware of these cultural differences while also using evidence-based interventions to provide the best care for their clients. These professionals must navigate this dilemma by using cultural competence, which involves understanding the background of their clients and adapting their interventions accordingly. However, the use of cultural competence can also create ethical dilemmas. Mental health professionals may face the dilemma of how much cultural competence is necessary to provide the best care for their clients. For example, a mental health professional may be unsure if they should adapt their interventions to fit a client's cultural beliefs or whether they should stick to the evidence-based interventions that may not align with the client's cultural background. This leads to ethical dilemmas related to the effectiveness and appropriateness of interventions versus respecting cultural backgrounds and beliefs. For this video, we are going to narrow our scope to some of the indigenous peoples of North America. In some indigenous cultures, traditional healing practices and beliefs may play a significant role in coping with stress and mental health issues. These practices may involve ceremonies, traditional healers, and the use of medicinal plants. However, evidence-based interventions for stress and mental health issues may not always align with traditional healing practices. Some evidence-based interventions may involve cognitive behavioral therapy or prescription medication, which may conflict with traditional healing practices. Your ethical dilemma questions to answer are: what do you think mental health professionals should do when a client's cultural background and the professional's evidence-based practices come into conflict? Which ethical viewpoint do you think the mental health professional should use to navigate this dilemma? And what made you pick this viewpoint?